The human body is an amazing structure consisting of trillions of cells which make up different organ and tissue systems. These systems are under the control of the central nervous system, namely the brain and spinal cord. Every second of your life, billions of nerve impulses, also known as action potentials, are generated and pass through the central nervous system to the other systems in order to keep your body and mind in a healthy and balanced state of being. When this healthy and balanced state is disturbed by either injury or disease, nerve impulses or action potentials inform the brain of this disturbance. Now, even though pain is an unpleasant experience, it nevertheless plays a crucial role in protecting the body from further harm and damage. Pain is often intimately associated with inflammation, which is an extremely complex process associated with injury and disease. The inflammatory process often involves joints. This condition is known as arthritis, which frequently affects the knee joint. The clinical signs and symptoms of arthritis include pain, swelling, redness, heat, loss of function, and stiffness or reduced mobility. The synovium is a thin membrane which lines the cavities of synovial joints and serves to provide nutrition, lubrication, and protection of the joints. Within the connective tissue that supports the synovial membrane are numerous nerve endings and small blood vessels. These free nerve endings are in fact pain receptors, also known as nociceptors. These nociceptors generate pain signals which travel along nerve fibers towards the spinal cord and brain. The small blood vessels transport numerous red and white blood cells and platelets, all of which play a vital role in the inflammatory process. During the process of inflammation, these blood vessels swell or dilate, and the flow of the cells and platelets slows down, causing the platelets to clump together. This process is called stasis. At the same time, the widening of the blood vessels creates openings within their walls. Fluid called exudate then oozes out of the blood vessels into the surrounding tissue, producing heat, pain, and swelling. White blood cells adhere to the inside walls of the blood vessels and slowly pass through these openings into the surrounding connective tissue. The exudate contains chemical compounds, including harmful prostaglandins which generate the pain signals. Under normal circumstances, nociceptors do not easily produce pain signals, but due to the acidity of the exudate and the presence of these chemical compounds, the nociceptors tend to fire more readily. As the exudate seeps through the synovial membrane into the joint cavity, causing it to swell with consequent stretching of the capsule, more nociceptors begin to fire, generating more pain signals and acute pain. After a short while, the constant acidity of the environment and the pressure of the swelling causes a significant reduction in the generation of action potentials. This results in a significant slowing down of the process of healing and repair. Now, the chemical compounds produced by the inflammatory process seeps into the synovial fluid within the joint space and cause destruction to the joint cartilage and bone. And consequent to the inflammatory process, the pain signals are transmitted from the inflamed knee towards the brain, where they are processed. After processing the signals, the brain instructs the pituitary gland to produce a neurohormone called beta-endorphin. Beta-endorphin is a potent natural analgesic substance which initially relieves pain when it attaches itself to receptors on nerve cells. However, in the long term, as a result of ongoing pain, the overproduction of beta-endorphin has numerous harmful effects on the body, in particular a reduced blood flow to the heart muscle, and therefore has to be reduced. Now, at this stage, it is important to highlight the two problem areas described, and they are, firstly, the slowing down of healing and repair as a result of the reduction in the generation of action potentials at the site of inflammation, and secondly, the simultaneous overproduction of beta-endorphin with all its associated harmful effects.